Welcome back to the channel, friends. This is part 2 of why people are afraid of the dentist. If you haven't seen part 1, be sure to go check that one out, but you don't have to watch these in order. It's basically just a big list of reasons why people are afraid of the dentist, and I broke each one down to let you know why they're afraid and things that dentists can do to help alleviate these fears.
I just solved it! Yes!
So everyone has a different perspective on dentistry, and most of the time it's negative. Patients come in all the time telling us how much they hate us and how much they hate coming to the dentist. Pretty crappy thing to hear, especially the fact that I'm hearing this from people that I've never met before. That being said, there are several valid reasons as to why people hate the dentist. So I'm going to break down the 3 biggest reasons why people actually hate the dentist. Maybe you've experienced some of these. Maybe you haven't. Maybe you're a dentist and you didn't know that your patients struggle with these. So my goal with this video is to provide value to both patients and dentists to help improve the dental experience in some way. Okay, let's get into it. So let's talk about the thing that sends shivers down everyone's spines: needles at the dentist. So guys, I get it. Needles are not fun. Your mouth is super sensitive. Injections in the arm versus injections in the mouth are just 2 totally different experiences. And yeah, the ones in the arm definitely hurt. So anything in the mouth is going to not be as enjoyable. I get it. So it's very valid that people don't like this part of the dentist. However, the alternative is that you don't get numb, right? Because needles are used to get patients numb before treatment so that way they don't feel anything during the treatment. So the alternative is that you don't take the needle, you don't get numb, and then you have to experience a drill drilling into your tooth, rattling around in there, and that is not the most comfortable thing. I will say though, I have patients who are so afraid of the needle that they would rather not be numb for the procedure when we're doing fillings, and they tough it out. It's the craziest thing because a drill in my mouth would freak me out, especially if there's no anesthesia. So while I applaud these patients, it's pretty wild to know that people just don't want any anesthesia whenever they do dental work. So I've been told by my patients I give the best injections, and I'm pretty proud of it because I know how much people don't like giving injections, but it's not because I'm great. It's because I've learned great techniques. So 2 things that we like to do is 1, we like to make sure that the gum tissue is numb, and we achieve that by using topical anesthesia. And a good way to do that is to make sure that you place gauze on the area is dry, and then you place the topical. It's usually a jelly. It's kind of like that tropical fruit, like grape flavor. I'm not a big fan of the grape flavor, but we have it because some people like it. And so what this does is this allows for the tissue to absorb the topical gel, and it gets the gums numb, so that way when the needle goes in, it's less painful. Then while the needle is going in, I like to use my mirror and make movements in the mouth and almost kind of tap slightly on a tooth or on the jawbone. What this does is this is a dull tap, so the patient now is focused on that and they don't really feel the needle. At the same time, my assistant, who is amazing, is tapping on the patient's shoulder. So the patient, before the needle even goes in, are feeling someone tapping here and feeling someone pushing here, and then the needle goes in. By the time the needle's in, they don't even know what happened. So I'm in and out before they even know what went down, and then they're nice and numb during the procedure, and the procedure goes pretty smoothly after that. Now, I know that was a lot, but that's a technique and it's super useful. Feel free to use it. Patients, if you have a fear of needles, please tell your dentist, because when you don't tell us something, we don't know it. But if we do know it, we can take measures to ensure that you have a comfortable experience. Again, I have some patients who don't care about the needle, and I don't have to do all this stuff. And I just open it up, drop the needle in, give them the anesthesia, and they're all set. I don't know how they do it, but they do. On the opposite end, my wife is terrified of needles. She will literally scream. So yeah, there's a spectrum of people when it comes to their fear of needles, and you just need to be clear with your dentist on how severe your anxiety is of the needle. They will help you, I promise. So before we move forward in this video, please subscribe to the channel if you haven't already. Whenever I see subscribers, comments, likes go up, it really gets me excited to make more videos, because at the end of the day, this takes a lot of time, thought, and effort, and I want to give you as much value as possible. So please subscribe to the channel if you haven't already, and we can get back to the video. All right, raise your hand if you've ever felt embarrassed whenever you're at the dentist. Probably because you're embarrassed about your teeth or your oral health, maybe even your breath. Look, we get it. Chances are you do not have the worst mouth we've ever seen, if that makes you feel any better. But don't worry, being at the dentist is a judgment-free zone. We literally see patients every day and we work in their mouths. So what may be a big deal to you is really not that big of a deal to us, because we have been trained and we are working in patients' mouths all the time. I'm not gonna sit here and lie to you and say that it's the most enjoyable thing disgusting being in someone's mouth while they have saliva and the breath may smell and they have cavities and all this, but it's what we do and it comes with a job. Back to you. You may be aware that you've been slacking on your oral health. Maybe you're not flossing as much as you should. Maybe you're not brushing as much as you should. So you know that things might be a little funky when you come into the dentist. That's okay. The best thing you could have done was come into the office, and you did. Now you let the dental team help you. So just to reiterate, being at the dentist is a judgment-free zone. Be open and communicate anything that you may be worried about so that way we can address those concerns. The worst thing you can do is just stay quiet and not say anything, because now what that does is you're relying on the dentist to guess and figure things out, when if you just tell us what is on your mind, we can get to the core issue of it as quickly as possible. So have past dental experiences left you with a lingering fear? So maybe something bad happened to you before, and now you think every time you go to the dentist, something bad is going to continue to happen. This is an unfortunate truth and reality for a lot of patients. The trust between the dentist and the patient has been broken. And this comes from an experience where something happened. Maybe you got a filling done and you weren't numb and it hurt a lot. Or maybe you went in for a tooth extraction and the tooth broke while the tooth was coming out. Totally normal, by the way, it happens. But then it led it to becoming very painful. And now you just assume every time you're going into the dentist, something is going to hurt, something might break, something is going to go wrong. And so that just becomes overwhelming. Maybe you've had teeth taken out without any anesthesia. I hear this from some patients that back in the day when they were kids, dentists wouldn't even get them numb and they would sit there and try to rip teeth out of patients' mouths. This sounds like a horror movie, and I'm so sorry if this has ever happened to you. This is not how dentists nowadays are being trained, nor is this how dentists should be practicing at all. I personally try to practice with a high level of care, prioritizing the patient's experience, and I never want to put you in an uncomfortable situation. There are a lot of other dentists out there today who practice with the same philosophy. So if you have a bad experience and you're not comfortable with the dentist who's working on you, don't think that this is normal for everyone in the industry. Maybe you just have a bad dentist, or maybe something went wrong and it wasn't anticipated. There's so many factors and variables that play into these treatments, and a lot of dentists do try to take the time, effort, and care to provide high quality care, but there's just sometimes things happen. That being said, be open to talking to your dentist about these experiences. Let them tell you that something happened, and then they can tell you, ask them, hey doc, that really hurt. What happened? Is that normal, right? These are the things that you are totally allowed to ask and question, because every dentist practices dentistry differently. And so you don't have to accept subpar care as your standard, because there's plenty of dentists out there who are willing to help you. So I hope this helped give you some insight as to why people are afraid of the dentist. Again, this was part 2 of my series that I created. You can go back and watch part 1 to see the other 4 reasons why people are afraid of the dentist. Be sure to use these tips at your next visit to ensure you get better care. Hopefully the results will be good for you. I did make a video where I talk about how you can eliminate the fear of the dentist. Be sure to check that out if you're interested. Thanks. I'll see you in the next video.